5, 4, 3, 2, 1, 0.
Ladies and gentlemen, I appreciate very much your generous invitation to be here tonight. You bear heavy responsibilities these days.
Welcome to Stock Legends Radio Show, seeking answers, opinions, and the inside scoop, putting you in the front seat on Wall Street.
In today's market,
this is breaking news. Where is it going next?
StockLegends.com.
Ladies and gentlemen, welcome to Stock Legends Radio, episode 22. Please welcome today's hosts, myself, Quick Draw. Also today is a special guest. We have the chairman of the board, Mr. Grant Walsh, from public ticker symbol MDFZF, Medifocus Inc. Grant, welcome to the Stock Legends Radio Show.
Thank you, Justin. It's an honor to be here.
Oh, it's our pleasure. You're in an exciting segment right now, and you have a lot going on with your company. We actually have the unique opportunity of speaking with you due to the fact that you primarily are a Canadian-based company that's looking to ingrain yourself in the U.S. market here, and you have a phenomenal product. So typically when a company comes into the U.S. markets, they're kind of feeling around for a niche or exactly what they have going on, but you guys have an amazing technology. But before we get into the meat and potatoes of the technology and everything you have going on right now, Grant, why don't you tell us a little bit about your past and your past with the company and what brought you guys to where you are today?
Well, my past is in multiple chapters, but primarily it's in healthcare. I'm a healthcare executive, a hospital president. I serve on boards because of a particular interest that I have in governance. And about 5 years ago, I met a man named Dr. Augustine Chung. He's a PhD, and he was the founder of a U.S. company called Celsion, and he's the founder of Medifocus in Canada. And Augie asked me if I would serve on this board, which led to a long-term relationship between Dr. Chung and Medifocus and me that's turned out to be a very exciting relationship. For me, Justin, I've been on over 30 boards, and I currently am the chair of 2. And this is one of the most exciting things that I've ever been involved in. Just to give you a little personal anecdote of why this is important to me, all of our families have been affected by cancer and this dread disease that impacts so many of our lives. But Dr. Chung asked me to serve on this board, and about a year after he asked me to serve, my daughter died of cancer. And I tell you that I was interested in the subject of Medifocus before, but now I am passionately committed to the subject of cancer and improving the standard of care, and if we at all can in our lifetime, eradicating this disease from our society. So that's kind of my background, Justin, and it's just such a pleasure for me to be with you today. First,
I'd like to say, I'm sorry to hear about your daughter. And the cancer, it is one of those things that just kind of creeps in and it finds a way to grab hold of so many lives and take them over. It's difficult because the speed in which the cancer can spread, it's almost difficult to combat once it gets to a certain level. So this technology right now, number one, there's a huge need for it. And number two, it works. I mean, you guys have gone through some studies here. For the listeners that aren't up to speed as far as what Medifocus does, you're primarily a medical device company, but you own a patent in microwave-focused technology. It's actually called the Adaptive Phased Array System, which uses targeted microwave energy to destroy cancer tumors or at least significantly reduce them. Studies were around a 50% reduction with chemotherapy. Is that correct?
That is correct. Justin, I used to live in St. Louis, Missouri. And it was a defense city in 1990 when the wall came down and peace on earth was declared. President Reagan at the time asked the defense industry to reallocate its resources from national defense to societal good, particularly healthcare. And Dr. Alan Fenn, F-E-N-N, of MIT, was involved with a technology that was used for targeting missiles, and he adjusted his attention from national defense and heat-sensing missile find to an attack on cancer. And so it's not as if this is a new technology. We are in partnership with MIT related to that patent and the focus of heat on the disease cells of cancer. Just as you would in space, we're doing that within the human body. We have two technologies that are related to heat therapy, Justin, and one of them is the one that brought Medifocus into being, and that is breast cancer treatment, which uses focused microwave technology in the elimination of breast cancer tumors. And the second is called ProLeave, and that is it's a commercialized product for the treatment of non-cancerous enlarged prostate. The unique characteristic of our technology is that although we're focusing in right now on breast cancer and prostate, this technology can be used in any form of cancer. So we are hoping that this will be an incredible resource for our society in eliminating this disease.
This technology is really amazing because I think the community as a whole, because of how many people and families are affected by the cancer, are searching for any kind of reduction or any kind of remedy. An extra year, an extra 2 years, an extra 3 years. I mean, it's tough, when you're talking about cancer. It's not like a normal type of disease because we're literally talking about time on somebody's life. So, I mean, what would an extra 3 years look like? To be able to spend with your family.
Incredible.
I mean, it's incredible. It's incredible.
Well,
it's time,
obviously I can speak to it personally. I'm a healthcare executive, Justin, so I have that interest in the eradication of cancer. And I'm the dad of a daughter that died of it, so I'm personally passionate about it. And I'm a capitalist, and I tell you, this is an incredible economic opportunity. And today we're really here talking about what this means as an economic opportunity in our society, and not only in the United States or in Canada, where I'm currently situated, or in Asia, around the world. This is an incredible technology to focus heat on diseased tissue and kill it, reduce its size, and destroy it. That is just a wonderfully innovative concept.
It is extremely innovative. So it targets the heat on the actual cancer tumor, and does that put the cancer almost in like a defense where it either breaks up or does it just shrink down? Or like what does that kind of look like?
Well, if you were to please allow this example, but if you were to take a piece of lard and put a cube of beef in the middle of that lard, and then you microwave it, you would cook the beef and the lard would be cold. So that's the way focused heat works. So a tumor has water content that exceeds the water content in this case the breast or in any part of your body where we are focusing this heat. And so it actually heats, shrinks, destroys the tumor, and does not negatively impact the tissue that surrounds the tumor.
That's amazing.
That's the incredible thing. Now, if you use that in conjunction with chemotherapy, it just compounds the effect of that. And, 50% reduction, but it's 85% reduction from the beginning, 85%. Right. And that, in fact, can destroy the tumor completely. That's just one of the products we're into, Justin, but that's awfully exciting for our society.
Oh, that's very exciting. And, from that point, the chemotherapy comes in and just basically, is able to wipe out and clean out the slate. Now, would these be performed in like sessions? What kind of sessions would they be? Would it be similar to a chemo session, except they would just go in and receive this focused microwave treatment?
Medifocus is in third phase of its clinical trials. It has been approved as a cost code, so there is current reimbursement in the phase 3 of clinical trials of $5,000 per session, and we can do 3 of those sessions would be the appropriate quantity for a patient to have. So as you can see, the economic opportunity is $15,000 per person, and the cost of it is the cost of the one-time purchase of the equipment to do it and the disposable. the disposable probe which focuses the microwaves into the center of the tumor, and the tumor is destroyed.
Wow, that's unbelievable. That is
Yeah,
very
well,
as
so
far
to make it, for our listeners to know that when you make it to the third phase of clinical trials, you have climbed over a number of hurdles. But this, of course, has climbed over the hurdles of phases 1 and 2, and we have about 90 patents, global patents. So it's not as if anybody can sneak up the side with some other technology, as worthy as it may be, but we really are far ahead of anyone else who would be using heat in the treatment of cancer.
That's pretty amazing. Let's talk about this other patent.
ProLeave.
Yeah, ProLeave. Now, this is a heat treatment
Great.
system for BPH. ProLeave was you guys originally sold ProLeave to Boston Scientific Group. Was that correct? And then purchased
Yeah, well,
it back?
Dr. Augustine Chung, again, was the founder of the company called Celsion in the U.S., and Celsion still exists. And while Dr. Chung was the leader of Celsion, they sold this particular innovation, which we call ProLeave, to Boston Scientific. And they did that in 2007. Now, Boston Scientific just sold it back to us, to the same group that created it. Now they're a part of the Medifocus team instead of the Celsion team. And Boston Scientific sold it back because their strategy adjusted, and large corporations adjust their strategy, and Boston Scientific is a great company, and they strongly believe in ProLeave. And they wanted it in the hands of people who could take it to the next plateau, and so it seemed logical that the people who created ProLeave should get it back and take it on to great things. And so it is a commercialized product. It went through the 3 phases of FDA approval, and Boston Scientific kind of backed off on it because their strategy had changed, but we have picked up at that point with the same management group that founded it, and the same sales team that was taking it across America. And we're taking it back to the 250 urologists' offices where equipment was sold that supports ProLeave, as well as we have about a dozen mobile clinics that we are taking out beyond urologists to general practitioners. And the concept of this is that we sell a piece of equipment to a urologist or a general practitioner, and as one of these individuals is so capable of doing through a catheterization, if someone is having a frequency or retention problem, whatever may be the problem related to an enlarged prostate, they simply insert a catheter, and within that catheter there is another device which focuses heat inside the urethra, and then they use a balloon to expand the prostate passage, and as a result, within 45 minutes, the person's problem is solved with no negative impact whatsoever, and the person can leave immediately and no longer has the symptoms or problems that they came into the office with, and it is non-drug related, non-invasive, and can be done in the physician's office. It's an alternative to drug therapy. So the market that we're actually going after
is a huge market.
Is the market
right
of the pharmaceutical industry, which for this specific utilization is an $8 billion industry. So do you want to take a pill for the rest of your life, or in 45 minutes you want me to fix you?
Oh, that's amazing. Actually, I have a family member as well that's in the medical device industry for Nuvonix, and that's an extremely huge industry. Now, the fact that you're able to market that, through medical device reps also opens up, the market that's outside of the hospital, because aren't there also additional insurance benefits for being able to do it in the local office with a doctor rather than at the hospital? Or
absolutely, a urologist or a GP can make more money on doing this in their office than for any other procedure that they do in their year, with the exception of some very unusual surgeries, I suppose. But this is a very attractive technology for urologists and general practitioners. And if they choose not to buy the piece of equipment from us, we can actually bring our clinic to them, our mobile clinic, and with our technicians, we can assist the physician in providing the service to their patients on a scheduled basis, and of course we get paid something more for providing the clinic, but the patient is cured just as well.
Now, for the listeners today that might not know, some of the younger investors, now how exactly does an enlarged prostate affect a patient, and what kind of long-term effects, negative effects, could they have, just as a roundabout type of question?
Well, just for all those young guys out there who are trying to anticipate the future,
they haven't had that. They haven't had that special appointment with the doctor yet.
Yeah, right. It's coming. 50% of the men over age 50 have enlarged prostate, or BPH as it's called in the medical profession. 50% of those over 50. 90% of those over 70 will develop symptoms of BPH. Now, the symptoms include things that would be familiar to everyone: urgency, needing to go all the time and needing to go immediately; nocturia, which is that means during the night you need to get up and go, right? Hesitancy, can't go. Weak stream, retention, intermittency. Those things, although they're not life-threatening, they certainly can be embarrassing, inconvenient, and the quality of life of BPH sufferers are badly compromised. So this is quite a common condition for men, certainly over age 50, and the market is $8 billion.
Yeah, I mean, if it's that large of the population, it seems like something that would almost be used by everybody before they reach the age of 70 or 80 for the most part.
Well, that would be
the majority.
They should. Now, the market on Medifocus breast cancer treatment, the market for that is $4 billion, and we're talking about the North American market. And for ProLieve, the market is $8 billion, and we're again talking about the North American market. Before we branch out into some of the countries of the world where they have great economies, huge populations, and are seeking the solutions to their healthcare issues on a private basis. So just imagine the market if we take this to these initiatives to China, India, other places of the world. The opportunity is incredible.
That is an incredible opportunity. With Phase 3, they're saying that the Phase 3 trial with Medifocus APA 1000 breast therapy system for treatment of cancer, now there's going to be 238 patents will be entered into Phase 3 study in the United States and Canada. Is that a general number for the whole entire market?
238 patients.
Oh, I'm sorry, patients.
Yeah.
Okay, patients.
238 patients are a part of Phase 3.
Okay.
And those are North American patients. And quite simply, half of the patients are involved in the Medifocus technology, and the other half of the patients are doing what is customarily done under similar circumstances. And the comparison of 50% with the other 50% would indicate a dramatic improvement for those that use this technology.
For the listeners today that may not be up to speed as far as the bio segment in general, it is kind of one of them segments that the bio investors tend to stick with the bio stocks. They understand the process, the way these FDA approvals work. There's a large majority of the market primarily stay away from the biomarker because they don't understand how the process works. Now, since you are already in Phase 3, it's a unique opportunity here to be able to grab a hold of this after, in layman's terms, a lot of the hard work and mountains have already been climbed. So it's really an exciting time for your company, and I think it's important for the investors that may not even have the background knowledge in the bio segment to really take a good look at this. But what does Phase 3 look like, and primarily how long can Phase 3 take, and where in the process are you, just to kind of bring them up to speed as far as the timeline?
Yeah, if I may share, Justin, with how this relates to the other product, we have one commercialized service, and that is ProLieve, which is related to enlarged prostate. That that initiative is commercialized, fully approved, and in fact, cash flows the phase 3 of the breast cancer initiative. Now, obviously, we have great investor interest in this now, so I don't think we're going to have any problems raising investor capital on this, but that's where we are. Now, in phase 3, we are working in cooperation with academic medical centers in the United States and Canada, and we just acquired ProLieve in August. It came fully into our possession. So we're cranking up the sales on ProLieve. We're increasing the profitability of that initiative so that we can use the profits from the ProLieve project in funding the third phase of the clinical trials. And so that's where we are right now. Now, if we have 238 patients to do, we're planning on doing those in about 6 academic medical centers in the United States and tentatively 3 or 4 in Canada, because it's been approved for phase 3 by both the FDA in the United States and Health Canada in Canada. So we're rolling it out in multiple locations so that we can ensure everyone, particularly the FDA and Health Canada, that it's not just because we had one scientist in one place involved in this process, but we have multiple scientists and multiple patients across the continent involved in this process, and it will take us about a year to a year and a half to accomplish the trials, and then it will take us about a year beyond that to validate the results. Just because you complete the trials doesn't prove that it worked. You've got to allow some time. And,
right.
And the time is approximately 2.5 years to commercialization.
And that's amazingly close.
That is very close.
The thing about the bio segment that's different than a lot of the other segments, which I think is also very important to note. For example, if we were to take a look at a mining company, once they hit gold and they're able to pull revenues out the ground, that would be their time for the investors to want to jump on board. Now, what makes the bio segment unique is the fact that throughout this timeline, there are multiple milestones and opportunities for extreme profits. Unlike the other segments in the business, let's just say from the beginning, the inception of the idea until the time where that product is actually able to hit the shelves, you might have 200-300 humongous opportunities for profits as an investor. So that's what makes the bio segment very unique. They have these things which are called FDA calendars and a lot of other things like that, and the bio traders pay very close attention to them. So the fact that this particular product is in phase 3 and is a couple years to shelf, I mean, we've got some milestones that you'll come across throughout those trials over the next 2 years, which could, and from the sounds of it, will be extremely exciting for investors, because this isn't a shot in the dark. This is already something that there has been results put to. There's been some studies. So if you want to almost put yourself in the seat of the FDA or Health Canada and kind of take a look at the product from an intuitive direction and say, you know what, I think that this product does have the capabilities to be able to increase the odds or be able to diminish the cancer or the swollen prostates, whatever. You want to put yourself in their seat and decide whether or not you think that would be a viable asset to the medical community. And I think right here it absolutely will. Well,
Justin, early in October, there was an independent analysis of Medifocus and its potential. So these aren't our numbers, but other people's numbers. But the estimate is that these two initiatives of ProLieve plus the breast cancer program, which won't really be commercialized till about 3 years, that there's $120 million annual potential just in North America related to this, without even expanding it into countries that are seeking it. And so we're marketing at home and keeping it close to home before we begin initiatives elsewhere. But the opportunity appears to be, an independent analysis says, $120 million in the 5th year.
Right, and that is
exciting.
That is very exciting. That's off of roughly 200 placements. So unlike this particular system, unlike a drug that would sit on a shelf, it's an actual system that's like a treatment chair, and we have all of the information and pictures and information on the setup in our research report. But it's you have to think of it more or less as, you walk into the doctor's room and you've got the chair and the full setup. It's almost like a consistent revenue once it's placed there, other than the upkeep and, like you said, disposal and maybe some other fees. facilities. So you've got $120 million projected annual revenue off of 200 of these systems nationwide. When taking a look at U.S. and Canada combined, since it is going through both the FDA and Health Canada, I mean, 200 is a very small number. I mean, you might have 200 hospitals in New York State alone.
230,000 women in the United States develop breast cancer per year. And what they want to do is, of course, preserve the breast. Therefore, some treatment is necessary. So we have radiation, we have chemotherapy, we have radical surgery, or we have the use of Medifocus technology in conjunction with chemotherapy. And we hope that we will be able to avoid those surgeries that are radical in nature, even in name they're radical. The reason they're radical is because it is impossible for the surgeon with the human eye to determine how much to remove, so they must take more than is obvious. Our technology, after they go through our treatment and probably have chemo also, then after some time, the surgeon using a scalpel just removes the pimple that remains for cosmetic purposes.
So they would actually be able to save the breast. I mean, it's an extremely scary thing, and it's an extremely embarrassing thing. I mean, imagine imagine being put in that position, where you've got all these. I mean, that has to just, it has to be terrifying.
No matter how much money you have, cancer is, cancer doesn't protect anyone from its ravaging effects, and so no matter how much money you have, something terrible could happen to you if you don't find a procedure that helps you avoid those radical procedures. With women, obviously, which cancer should we approach first in our society? Well, breast cancer is something that certainly is highly market sensitive. And then prostate cancer for men, and the effects of non-cancerous enlarged prostate, which impacts so many men. But those two specific targeted diseases is the way we've approached this market, these markets, and we're very excited about the potential. And I'm just so delighted that Dr. Chung asked me 5 years ago to become involved in this organization, because just recently the light has come on and the future is looking very bright for us.
Well, it absolutely sounds like Dr. Chung is a man that has a game plan. He has a strategy in place, and that's very important when investing in a company for an investor's perspective. You want to take a look at the people who are involved. I mean, Dr. Chung here is involved with Boston Scientific. I mean, MIT, he's got you. I mean, this is a man that obviously knows what he's doing, which is very, very important to also note. When taking a look at the technology itself, it seems as if this microwave-based technology and heat technology, if it would work in a breast type of cancer, which a lot of times can be the most severe type of cancer, it seems like depending on how the delivery method is formulated, there might even be opportunities for future advancement and expansion on this current technology and being able to deliver it to other places of the body. And I'm just thinking outside the box on that.
Wow. Oh, you picked up on it. You picked up on the real opportunity, Justin, and that is that not only we're just dealing with two diseases right now, and they relate to prostate and they relate to breast cancer, but there is nothing in any type of cancer that you can imagine that couldn't be have improved care and treatment by the utilization of these technologies in focused heat.
Truly an amazing opportunity. It really is. It seems like you guys have already covered a lot of ground. Now, as far as this technology, when did it originally start phase one? I mean, how many years in the process are you already?
So you're ahead of before my time, but actually the focused use of microwaves, of course, that was part of defense. So back in the 80s. And in 1990, with MIT and Dr. Alan Fenn, it shifted toward the treatment of cancer. So we've been involved in this for 22 years, the treatment of cancer. And now the phases of the trials began about, I'm guessing, so don't hold me to it, but about 10 years ago. And now we're at the most exciting phase possible. So a lot of people in North America and around the world are paying attention to the opportunities that are presented through focused microwave technology.
It's almost an infinite opportunity. Now, ProLeaves received a $5 million private placement. You've got funding there. You're already in phase 3 of the breast cancer microwave treatment. As an investor in the U.S. market in particular, because primarily your stock on the TSX is a completely different animal. You have your own following there, but on the U.S. market, I mean, as a U.S. trader, you have to take a look at the current stock price. You have to take a look at the daily volumes. I mean, this is an undiscovered gem that has almost been overlooked by the U.S. market at 11.5 cents. Current OS of 74 million shares and a float of 24 million. I mean, your market cap's 8.5 million on the U.S. market. I mean, that's an amazing opportunity.
It's an amazing opportunity, and we have reached a highly enviable position in our development where I spoke to the former CEO of a major brokerage recently, and I said, we're presented with a dilemma. People want to give us money, and the question is, how much money should you allow? And
right.
Said,
well, yeah.
His rule of thumb is take all the money you can get.
Well, yeah. I mean, you have to think. I mean, right now with the stock at 11.5 cents, I mean, it almost would put you in a negative position to even talk to those kinds of people because how much would you have to give up? I mean, the stock now, in my opinion,
in dilution, right?
Yeah, an $8.5 million market cap. I mean, that's nothing. I mean, you've got technology and private placements alone that exceed that. So I mean, it almost puts you in a position, but I'll tell you who the real winner is here because you are faced with the dilemma on that side. But for an investor to be able to come in, now I'm not talking about the day trading market, but, the guys that like to get in and out of stocks rather quickly. I'm talking about the intelligent investors, the ones that actually make the money in the market. And those are the guys that open the book, they take a look at the due diligence, they take a look at the research, they take a look at the timeline, and these guys are saying, hey, you know what? I'm more than confident putting an X amount of dollar investment in this company, forward-looking 6 months to a year, 24 months. As you start to get a little bit more seasoned within the stock market and the $5 and under market in the U.S., you start to realize those are the guys you never hear about, and they're the ones that are making all the money, the ones that sit back and they wait and they acquire their shares. So this is an opportunity for those kinds of investors. And we'll be distributing this interview here to communities that have those kinds of investors, and we also want to send them to stocklegends.com. We've got a page there for MDFZF. We've got a research report. We've got technical analysis. We'll have the interview placed there. And this is really a phenomenal opportunity for investors that are looking for the undervalued. I mean, they're looking for the stocks that have almost been overlooked, and it doesn't get any more direct than the current price of the stock, an opportunity for the high dollar, high value investors.
Justin, I think it's important for investors to know that in spite of the fact that there are a number of major investors who would like to put money into Medifocus when it's at 11 cents, it is our intent not to accept more private investment capital diluting the stock, but in fact, we will raise money again, but we will not raise money at this price.
Oh, absolutely.
We'll raise money when it gets up to a decent price, and then there are other cancers to be conquered.
Exactly. And when you take a look at the market as a whole, there's a lot of the public companies within this segment and within other segments that are still kind of reaching in the bucket for an opportunity or even an avenue to go down. And take a look at MDFZF, Medifocus, and it's just so much opportunity, so much value, so much time and educated individuals involved within the medical segment that it really deserves a look from the investment community. And this is the type of stock that I would go after personally, just to give you an idea. So,
well, it's certainly a situation where, my personal conflict is I want to defeat cancer. I'm passionate about it, and I'm also passionate about economic opportunity and making a lot of money doing good. And here's an opportunity to make money and do good. And I'm honored to be a part of Medifocus and certainly to be a part of your show today.
And for everybody out there, anybody that has a family member that succumbed to cancer or that currently has cancer, obviously it's the perfect month for it as well. We'd like to send our best wishes out to you. And also, for any of the current investors in the stock or in other stocks in the bio segment, fighting cancer, also congratulate you. and we really want to bring our focus and more attention over to your company. We truly wholeheartedly feel that there is a significant opportunity here for the investors, and we'll be pushing and fighting hard to be able to put this information in front of anybody and everybody within the segment, as I think that they will benefit down the road.
You have a wonderful show. You provide a great service, and we thank you for focusing in on Medifocus. I appreciate it very, very much.
It's been our pleasure having you on the show. Once again, we want to direct the investors to stocklegends.com. We have the page set up for MDFZF, Medifocus. And Grant, do you want to send the investors anywhere else for any additional information, maybe on your end?
Certainly our website, but you have a wonderful site. You've done a great focused report on Medifocus, which we appreciate very, very much. And let's hope we can defeat cancer and make a lot of money.
Absolutely. Grant, it's been our pleasure.
All the best to you, Justin.